I had that's not two. Welcome back to ExploRN EmCheng. My name is EmCheng, and this week I'm going to answer two of the most common questions that I get asked all the time. So first one is, how much experience do I have and how much experience do you need before you take the dive into travel nursing? So I had 2.5 years of experience as a nurse before I dived into travel nursing. I got hired straight out of graduation into a nurse fellowship program that helped transition and support nurses to go into critical care areas such as ICUs and ERs. So I was hired into the main hospital that I had most of my clinicals, and in this fellowship program it was 3 months of didactics, which was a lot of self-studying. They had a lot of different programs and resources and lectures for us to do, and simulations in their simulation lab, as well as going into the unit that you were working on to do clinical days, kind of like when you're in school, you go in for 8 hours. So we did that for 3 months. So then the next 3 months, you are paired up with 1 or 2 preceptors and you follow their schedule and you train with them, and they train you to become a confident nurse. The next 6 months are a probationary period where there's resources available to you, educators and people on the unit, but you are on your own, and that's the year fellowship that I did in critical care. So I was hired into a cardiothoracic ICU, a CTICU, but at the time the unit was going through a huge transition and the hospital system was going through a huge transition, and they were trying to specialize each hospital into specializing in something. So actually all the cardiac cases, for the most part, the very complicated ones, actually diverted to a sister hospital that I ended up working at, but we'll delve into that. So I only took care of patients that were in the thoracic population, so people who were getting lobectomies, pneumonectomies. A lot of times they are oncology patients with metastatic cancer that had developed into their lungs. So we had a lot of those types of patients, recovering them from the OR, and then for the most part, I would say at least 75% of those patients were going up to step down the next day, which is great for them. But for me, I wasn't getting really sick acute patients. Now, during that transition period, they were also combined I call it the TICU, the thoracic ICU, with the coronary care unit, which was also downsizing because they were diverting all the acute complicated cases to the sister hospital. So I did get a little bit of CCU experience with thoracic intensive care unit for a little bit over a year, but I had only seen balloon pumps once or twice. I saw CRT once, and then my patient coded and died. But I wasn't seeing all the drips and all the critical care stuff that I had learned in the first half of my fellowship. So my plan was to get some nursing experience and then hopefully be able to transfer over to the sister hospital. Luckily, I actually did get recruited to the sister hospital a little bit over a year of experience, and so I got to work in a cardiothoracic unit, which was in the sister hospital that had all the things that I wanted straight out of nursing school. So I'm actually really thankful that I didn't start there, because it was such a sick population. We were doing ECMOs, Impellas, occasionally balloon pumps, LVADs, and just as I loved, we were doing heart transplants. And now I think if I started off as a new grad in that unit, yes, I probably could have done it. Of course I could have done it. But I got really good time management, nursing skills at my first hospital by not having the sickest population, and then I got to build on my nursing knowledge and that critical care experience in the sister hospital, and I ended up working there for a year and a half. I have a little bit over 2.5 years of experience, and I think I felt very comfortable with the things and the knowledge and the skills that I had learned in those 2 units. I had also done a little bit of moonlighting, which means that on my own schedule I could go back to my other unit, the other sister hospital, and the first hospital that I worked at, to work as needed, and that also built my nursing experience. Now, I did get a little bit of MICU experience just way in the beginning of my nursing career when they were training us and having those clinical days, so I probably have a month of MICU experience, but most of my experience is in cardiac, it is in open heart surgeries, it is in coronary care. So people who don't decide and elect to do open heart surgeries, I have experience with that population, and I absolutely love it. And I honestly suggest, and people say this all the time, and I really, really support this and feel this way, to have at least 2 years of experience before you do travel nursing, because the hospitals, when they hire you, and the agencies that are advocating for you and applying to jobs for you, are expecting you to be able to be dropped into hospital situations and to be able to take on patient loads that are rigorous sometimes. And no, you won't get the sickest patients, but they expect you to be able to manage and take care of patients with no support or no help at all. And I'm not saying that you can't ask questions as to where you define things, but in terms of being able to manage someone's care and having nursing judgment and clinical experience, that is essential as a travel nurse. And honestly, I think if I didn't have the experience that I had, I would feel way more anxious and nervous and overwhelmed as a travel nurse. And I already feel those things because I'm being put in a new environment, but not being comfortable with my skills and my knowledge is a whole other ball game that I can't imagine. So I highly suggest having at least 2 years of experience. So all the new grads that are asking me if you can become a travel nurse right out of graduation, no, you cannot. No agency is going to look at you. Maybe they'll look at you if you have 1 year of experience, and I only suggest doing or going into travel nursing if you're really, really passionate about jumping in, only if you have med-surg experience. Any other specialty, I would say have at least 2 years of experience. If you can take the sickest patients in the unit you're working in, then I would say yes, you are ready for travel nursing. So however long that takes you, make sure you learn when you are at your home hospital, when you're in your home unit. Float as much as possible. Try to get used to how travel nursing would be, being put in uncomfortable situations. Ask to keep taking care of really sick patients. If there's a new population or new devices, like, learn about it as much as you can, because it will only help you as a travel nurse. And you're going to be so much more marketable and experienced to these different hospitals, and they're going to want to take you more than if you just did the bare minimum. And I would also highly suggest getting any certifications in whatever specialty you're in, because that will only beef up your resume. So I hold my CCRN, which is the Critical Care Registered Nurse certification, and I also hold my CSC, which is Cardiac Surgery certification, and I highly recommend getting those certifications, because I have had managers and also agencies tell me that that sticks out to them, because not everybody has it. And when it comes to comparing to applicants for the same job, because I have those certifications and experience, they will definitely call me up for an interview over other applicants. So put yourself in the best situation that you can. Get any certifications, get any training that you can. Learn all the things that you can in the environment and the unit that you're in before you dive into travel nursing, and I promise you, it will save you so much of a headache and so much more anxiety and so much more of the overwhelming stress that you're already going to feel being a new travel nurse. And that is my experience, and also my recommendation for how much experience you need before you take the dive into travel nursing. Thank you so much for watching every week. I really, really appreciate all the love and support that you guys always give me. And if you can pass this video along to any of your friends that are interested in travel nursing, it just validates me making these weekly videos that I put a lot of work and effort into for you guys. So please let me know if you have any other questions or concerns or any suggestions as to what you want to know, because I want to be helping you take the leap into travel nursing and for you to live a life of traveling in the US and around the world, so that you can learn more about yourself and the world around you. Thank you so much for watching, and I'll see you guys in the next video. Have a great week, and let's go exploring.